Another year has rolled by, and it's once again World Cancer Day on 4th of February, and Bridges is joining the rest of the world to canvass for improved treatment, care, and of course prevention for cancer. And this year, the cancer is looking at care, which is also an important part of survivors to stay alive. Now, the cost of cancer care is not for the poor, but certainly not all rich persons can afford it either. Be that as it were, there is no substitute for life, and the value one can place on life is beyond monetary, especially if you are unfortunately afflicted with cancer. This year's theme is actually a 3-year theme for sustainability of all efforts. It's closing the care gap. I quote, adopted as at November 2021 at the International World Cancer Day. How very apt. Now, apart from all the frightful or inspiring buzzies around cancer, the cost of cancer is the bone of contention. We have on Bridges today guests who should know, and of course a survivor who would give us her experience in terms of care and how she's been able to live through it all, especially and again the implication of the cost to Nigerians and families, because when you are afflicted with cancer, it says it's not just about you alone, it's about the family. Well, having said that, I will continue to build a bridge as we try to put in word to improve care in cancer. I have with me here to my immediate right is a consultant oncologist, Dr. Uche Shagaya. You're welcome.
Thanks for having me.
Thank you for all the things you do with cancer patients, and thank you for building a solid bridge around it.
Thank you for having me.
Of course, we cannot go on without having the president of the Nigeria Cancer Society, who's been all over the world, I mean, as it were, all over the country, canvassing for improved environment for cancer care, not just care, treatment, access to medication, and the whole gamut of what makes life better for those who are afflicted by cancer. Dr. Adamu Al-Hassan Umar, our president, you're welcome again. So, closing the gap, building a solid bridge, that's where we go. First, let's just remind ourselves again, what is the state of cancer in Nigeria? Both of you, I just want you to speak to our audience listening. Let's go from the clinic.
Oh, okay.
Okay.
In the clinics, the numbers are rising. The people are still presenting late diseases, but it's not as late as it used to be 10 years ago. Telling me that the awareness he's doing and you have been doing has actually made an impact. But the numbers are rising, definitely. And you don't know, the inflation in the country has affected every sector. Health hasn't been spared either. So patients are coming, increasing numbers, they can't afford their treatment. Things are getting hard. There are only about 3 functional centers in the country for radiotherapy now. Despite the fact we know that at some point 60% of patients are going to need radiotherapy, cancer patients. So in the clinic, we are concerned. There have been some, little nice silver lining recently, which I'm sure we'll talk about. But it is still a major problem.
It is a major issue, cancer. And of course, with everything surrounding the environment and all that, that hasn't made it easy either. Now, okay, we know. Let's speak to the recent intervention, which government itself has provided, what you call the Cancer Health Fund. Now, what has happened to the fund? Because that is so important in accessing treatment in Nigeria.
Thank you very much once again for having me on this program. In an earlier version of this program, I spoke about the, challenges of access to care by patients, the lack of awareness that is out there, the lack of equity in the distribution of health infrastructure in the country, which is actually what necessitates the late presentations that we have in our hospitals, as rightly stated by Dr. Shagaya, the lack of purchasing power of households, even to, normal day-to-day, running of the house, talk less of, having enough to take care of health care. Yes, and these are the statistics that are actually very alarming, and these are the statistics that are making, particularly the mortality rate, the rate of death of cancer patients in Nigeria, to go very high. Because when you look at the statistics, when you look at the number of cases versus the number of cases that died, is truly very discouraging. Yes.
High.
Now, government, in its own wisdom, introduced the Cancer Health Fund, which targets 3 commonest cancers that we have in Nigeria: cervical cancer, breast cancer, and prostate cancer in men. Even though 1% of men also develop breast cancers. So now, the idea behind that is to ensure that those that don't have the means to access care are given a lifeline, so that they can at least access care to the best of their ability through the help of government. But unfortunately, due to the bureaucratic, bottlenecks that exist in the system, this fund came on board about 2 years ago. But we are in 2022 now. There were budgetary allocations in there 2020. There was another budgetary allocation in there 2021. And about 1 billion naira has accumulated over the course of those 2 years. And this year, we're actually very lucky. Because the way the legislative arm of government works is that when you demonstrate evidence that you don't need the money, they have every right to stroke it out. But we are very lucky the National Assembly has appropriated another 500 million naira in the 2022 budget. But as I'm sitting here today, no single kobo has gone out.
So we need to quickly build a bridge, to ensure that that money is one can access it. Particularly hospitals. How, in terms of criteria to get to that fund, is there a bottleneck with that?
Not really. What happens is that the patients are asked to go online and fill the CHF profile. They get a CHF number. They choose a doctor from one of the approved centers. So like for National Hospital, we're one of them. They choose one of the doctors to manage them. Then they come to the clinic where they're assessed.
Isn't that cumbersome? I mean, if, for example, an illiterate patient has to access that, because I would imagine that it would be for the poor of the poor who can't even afford anything. How would, especially that people are not digital, how do you access it?
Well, for now, I want to believe that because this is a phase 1, maybe this is the way it will go. I want to believe as we go further, these are things that they will get from feedback. And we'll make provision for that. But for now, they still have to have an online platform where they fill out, they come to the hospital, and then we assess and verify that they are really cancer patients and have a plan for them. But we also have to send them to the welfare department, who will determine if they feel that, based on standard criteria, if they qualify. Because I tell you, but the funny thing is that cancer care can bankrupt even the rich. It's not something that,
So Nigerian Cancer Society,
yes.
What's your take? I mean, how do we get, if the rich are affected, of course, the poor become generally more impoverished than they are.
That's
so what strategies are you putting in place to at least help the poor that is not digitalized and needs, these interventions?
Yes. Well, as rightly stated by Dr. Shagaya, the teething problems that we have at the beginning are things that we'll definitely overcome over time. But as advocates, what we are calling on government to do is to do the needful to commence the process of, patients having to benefit from this fund. And of course, we continue to engage them on sustainability, because the sustainability culture in Nigeria is very poor. And we need to be persistent, in our advocacy campaigns. We need to be persistent in engaging policymakers so that there will be a continuation or a continuum of progress, in the course of having making this fund to be accessible to patients. And of course, 6 hospitals are covered across the nation as it is now. There are 1 hospital in each of the geopolitical zones. National Hospital is one of them. Federal Teaching Hospital Gombe is another. You have University of Nigeria Teaching Hospital Enugu. I think LUT is also part of the equation. And I think University College Hospital Ibadan is definitely also in the list. And you have Ahmadu Bello University Teaching Hospital in Zaria. So now, as advocates, we call for more hospitals to be added to the list so that patients don't have to travel very far, to be able to access that fund. And of course, other forms of cancers, because cancer, like you rightly said at the beginning, is something that even the rich man is afraid of. It's something that even the level of richness in Nigeria, is something that you cannot categorically say this is a rich man and this is a poor man, because the middle level is not there in Nigeria. It's just the poor and the rich, and the rich people are very few. So cancer to even a rich man is truly something, talk less of a poor man.
Yes, something interesting that Dr. Shagaya came up with, and she was going to share with us, these telephone lines that you can see. I'm talking to viewers now, are telephone lines too. Can you just speak to it as you scroll it?
Part of the things we're trying to do to close the gap, to create that bridge that we're talking about, is for patients to feel empowered with information, for them to know who to turn to. So one of the things we're doing in the National Hospital, my department, is we're launching 5 lines. So if you're a patient, an oncology patient, who has some problem and you need to talk to a doctor on call, there's a number. It's going to be across the screen. Another one is, if you're in another center and you've been asked to go for radiotherapy, you have no idea how to get an appointment, or there's a number to call through medical records. If you've taken blood transfusion or been taking chemotherapy and you're having issues, there's a nurse to call. And then another one is, you've done your radiotherapy pre-simulation scans, and normally there's a little waiting time, or 3 weeks waiting time. You're hitting the 4th week. Nobody has called you. You don't know what is happening. There's a number to call. And then the last one is the number for the department proper. So you want a medical report, whatever information you want. There are numbers that you can call, and apart from the secretariat numbers, the rest are on 24/7. So this should really help to make patients know and have somewhere to turn to, because sometimes it's difficult. You are all the way in Maiduguri, you need radiotherapy. The closest center to you is Abuja. You don't know anybody in the hospital. Does it mean you have to get on the plane and come all the way and go back? And so with this type of information, I'm hoping that bridge will be formed, and you can just make a call, and you're booked and told all the information you need is documented nice. If you have to email stuff to you, we will. If it's one of those patients, and we also have room for those people who can't speak English and want to speak their local language. Yes. One of the things another thing we have that we did just today is a documentary. I made sure we had the 3 languages spoken, because it's easy for us to sit down here on the bridge and speak English. But I tell you, quite a fraction of Nigerians don't speak English, and it will be easier for us to really get to their level. So we had it in Yoruba, Igbo, and Hausa, and we hope as time goes on, we'll increase the languages.
Yes.
Because
wonderful. Another thing I'd like to, that we all know, particularly for you, the specialists know, is that there's a dearth of human resources in terms of treatment. And we're here, we have 3 years now to close the care gap. What would you be advising the government, because most of the government and other stakeholders?
Well, thank you very much for raising this very important question. We all know the statistics of the healthcare workers in Nigeria. Not only healthcare workers, particularly the specialists. We were at the National Hospital yesterday, and the CMD was lamenting to us that they advertised twice for therapy radiographers. Nobody applied. And the very few ones that are around are overworked, you see. And this is not even talk of the oncology nurses, the oncology pharmacists, and the clinical oncologists. So death of healthcare personnel is the issue that is actually creating a big gap in Nigeria. And with Nigeria having over 50% of the population living below the poverty line, The same 50% again living in rural areas. And when you look at the distribution of these health facilities, and even the clinicians, the specialists, 80 to 90% of them are in the urban areas. And you go back to the localities, you begin to appreciate the level of gap that is there. And in fact, this is the reason why the Close the Care Gap campaign that is starting this year is timely, because this is the opportunity that we have to sit down and look at all these health inequalities and look at all these health inequities that exist around us. You know, it will surprise you to know that over half the population of the world don't have access to essential healthcare services. And you know, the pandemic of COVID-19 has succeeded in pushing over 500 million people across the world into extreme poverty. So what are we talking about?
What are we talking about?
You know, so the earlier we start realizing that fact, the better. And you look at the National Health Insurance Scheme in Nigeria that still has coverage of less than 10%. And like I mentioned before, Nigeria being a signatory to the AU agreement of 15, not less than 15%. We are still operating below 5%. Where are we? So we need to reawaken our consciousness. We need to re-engage. We need to ensure that we, as we look forward towards closing these gaps, you know, we all hands must be on deck.
Okay. Quickly, I'd like to come back to you, and I'd like to celebrate Dr. Shagaya, by the way, because oftentimes, I mean, consultants at this level planning to leave the country. So thank you for staying on and helping us to build the bridge to close this gap. Now, yes, what are your fears?
My fears?
Yes. What are your
about the gap?
About the gap.
The gap is like literally a pipe that has holes in it. So you start from the awareness that makes you come with late presentation, then diagnosis. Some diagnoses, we have lots of issues. The pathologists are general, they are overworked and then clustered in the urban areas. And then you get into diagnosis. Now imaging and all that is expensive as another pipe. And then the treatment. Generally, radiation oncologists, you know, cluster around machines. And I just told you that there are only 3 centers that are functional. There's the National Hospital, there's Luth, and then the private Masorus in Lagos. 2 of them are in Lagos, we are in Abuja. So the other centers are there, but their machines are not functional. So with every part of the leaky pipe, there's a fear. When is the patient going to get diagnosed? When will they get access to care? Will they be able to afford the care? Will the family support system? I mean, if you come to Abuja and you have to be here for 6 weeks and you don't have family, how do you cope? How?
That's the how.
Yeah.
That's the how to close the care gap. And this discussion would continue at some point again. We'll have you on. We do hope that when we have you on, there'll be some ray of hope. This is what should happen, and that's why Bridges is so interested in it. We'll take a short break. When we get back here, we'll bring a survivor, and then we have the closing remarks of our consultants, and of course the president here himself, a clinician. So stay tuned. Cancer really can be a thing of the past if we present on time. Welcome back. We're looking at cancer in all its ramification, using the theme closing the gap, the care gap actually. That's what we are speaking to. And at the moment, I'm just so excited to bring on a survivor who would share her experience with us, that will further say that when there is care and treatment on time, there's hope for surviving. So I'd like to bring on Fumilayo Osiebu. Yes?
Yeah.
She runs a foundation in Kwara State, but more than anything else, she's a survivor herself. Now, thank you for coming on, Bridges.
Yeah.
Give us a little snippet of your experience, and then we speak to the gap. You know, what are the gaps that we should close that will, you know, produce more survivors like you?
2013, I was diagnosed with breast cancer. I started first I started the treatment first here in Nigeria, but when they could not go further, I mean 2013 till date, there's been a whole lot of improvement in the cancer space. There's still some improvement going on, no matter how we want to see it. And when the doctor found out they couldn't do much, we were advised, myself and my husband, if we have the funds, we should travel. And that was when the journey began. And I'll tell you, my treatment was top-notch. Coming back to Nigeria, had my chemo, was prepared by a medical oncologist, actually in Dubai. Then I came to Nigeria and found out everybody dabbles into the cancer space. And I just couldn't understand it because it took quite some process for me to get to that point of treatment. Then, and that was what stirred me up to start the initiative, the advocacy, the awareness, you know, to be able to provide psychosocial support to other women who are ready to open up, because one of the problems we have is that people hide. That culture of secrecy is there because of stigmatization and all of that. Mine, I'll say, thankfully, I acted fast. There was no pain, there was nothing, but I noticed something unusual happening to me in my breast. And I quickly sought medical attention. And that was how the process started. So I'll say it was actually early detection. And we're still at the point of prevention and early detection in Nigeria because we don't have all it takes to treat us. So that was the experience. It's traumatic. It's not an easy journey. It's a journey, I tell people, it is a journey of the mind.
Can you share some of these challenges with us? Because that's where we're going to be able to...
Because even policymakers couldn't believe when I sent them letters that I was going to have that work. Are you sure you want to bring yourself out there?
So,
and I
there's
said,
denial.
There's denial, there's secrecy, there's lack of funds, there's environmental problems, inadequate manpower. In Ilorin, for instance, you only have one surgical oncologist. No, okay, mammogram probably two or three, probably. No radiotherapy, no radio oncologist. So it's tough. So sometimes I find out that sometimes I even almost want to fight to get people, okay, get out of Ilorin because you can't do this here. This is where you have the specialists.
So you're worried about diagnosis as well?
I'm really worried. A lot of cancer patients are being mismanaged.
Okay. Now, well, as we round up on this edition of Bridges, and with your excitement and the fact that you're a survivor, what would be your last take? What would be your final word here? I mean, since the theme in the next 3 years will be closing the care gap, what are these gaps that we need to close like yesterday?
The gaps that I want to see happen is, first, we need to have more. We need to have enough manpower in this space. We don't have that human resources. We do not have it. It's a challenge. And having adequate equipment, I think it will go a long way. And the awareness and advocacy, we need to loud it more than we've ever done.
So yes, so getting it loud out there, and that's what we're trying to do on Bridges. Losing a friend, losing an aunt, and seeing people around who actually did not scale through the cancer affliction just breaks my heart. And this particular program is dedicated to the memory of my friend and of course our colleague Sarah Rajre. And I do hope that the spirit of hope that Fumilayo has brought on today will be one that will help close the gap of the high incidences of mortality associated with cancers. We on Bridges are committed to give it a loud voice to ensure that people present early, because as we all agree, early detection saves lives. I do hope that we will be able to save as many lives as possible, and hope that government will accelerate the cancer health fund so that it can be made available so that more indigent people can access treatment. But more than anything else, still we know that the things that you should do, for example, have your mammogram as women, and for men, get your prostate tests done on time so that we can have more healthy Nigerians building a better world. That's it on Bridges. We'll be back same time next week. Thanks for joining.